Hi, I'm a second-year resident here at UC Davis Medical Center, and I just want to talk to you guys about this change in the Health Net insurance policy that UC Davis is having right now. I just want to talk about my concerns with my patients. I have multiple Asian patients who I've been taking care of for the past couple of years, and a lot of them I actually take care of the whole family, the mother, the father, the kids, and I've actually seen them the past couple of days, and they're all really worried about what this policy means for their family, and I am very worried too. A lot of these families have multiple medical issues. They see specialists from neurology to pulmonology. They have COPD, they have high blood pressure, and there's a lot of social and economic things that I know as a primary physician over the past couple of years. And what I fear is that once they lose their insurance coverage, a lot of these really important issues that physicians here are taking care of are going to be sort of lost to follow-up, and these patients are going to suffer. And there's months that are going to go by when they're going to look for new insurance and their health is going to deteriorate. And by the time they find a new primary care doctor to help them out, they have to sort of relearn the entire medical history and sort of develop this relationship with their patients. And that is ultimately going to, again, the patient's health is going to suffer. Also, in terms of our resident education, we see such a diverse patient population, and what I'm afraid of is when we lose these patients, our education as residents, it's going to suffer. And not only the residents, but the medical students who we teach and who learn from us, they're not going to be able to see the diverse patient populations that they're going to take care of in the future. And I think me, as a resident, I'm not going to be able to have that diverse patient experience and be able to see these different members of the community who I ultimately want to serve when I leave residency. So ultimately what I'm saying is that this is not just a patient problem, it's not a resident problem, it's not a medical student problem, it's not a clinic problem, it's a community problem. And this affects all members of our community, and we really need to do something about this because ultimately our community is going to suffer in the future if we don't.
Hi, I'm Lisa Netherland. I'm a second-year resident here at UC Davis, and I wanted to tell you a little bit about how I and my patients are affected by the new changes with UC Davis no longer accepting Medi-Cal patients. So for me personally, I want to start with that because I chose UC Davis originally. One of the big factors was being able to train with underserved communities, and having that include ethnic diversity, socioeconomic diversity, and for me that was very important. When I was going through my residency application process, first on my list was underserved community medicine, and if a program didn't have that, I crossed them right off my list and they were out. And so UC Davis, I felt like I got great opportunities here. What we've gotten historically is a mix, so that when I get done, I can serve patients of any kind. My heart is in underserved community medicine, but I also feel like I would get the mix of that, my insured patients, Medicare, all of that. But that was very important to me, and so it was one of the big reasons I chose UC Davis. I'm losing that opportunity now, and I can seek it out myself in other places in our community, places that have underserved communities, Gender Health Center, Tapate Clinic, but that was important to me, that it was part of our mission, and it feels that it's no longer part of our mission when we've taken away that part of our population. The other thing is that it affects my patients as well. So a couple of personal things I can tell you about patients who I've been working with. One I want to share about, and I'll just give you general information because I'm not wanting to tell anything specific about a patient without permission from them. And this is an example of the kind of patient that is going to lose what they've had from UC Davis for so many years. I have one person who has been seen by us for, 2 decades, seen in our clinic particularly for at least a decade. She's on long-term pain medications that are ones that will be tough for her to get out somewhere else in the community, because right now she's on a combination that is not something that should be continued. Part of my work with her has been to approach pain management for her in a different way with non-addictive medications, things that are not dangerous, so that we can get her in a safer place. So it's been a lot of work, because that's very scary for her and for other patients who are in a similar situation to change now. So I've been working on making this change, gradually tapering her off of the addictive medications and getting her onto alternative regimens. When she is no longer cared for by our practice, I don't know where she's going to go immediately, because with people trying to find a healthcare provider in this environment where there's already a shortage of primary care physicians, she's going to have a very difficult time. It could go one way or the other. It could be that someone else out in the community goes ahead and just prescribes what she's been on for years that could end up being dangerous for her. Or somebody may just not prescribe it at all, and she's going to suddenly go into withdrawal, which is not the way that you care for patients. So I worry about her. There's a lot of other of my patients who I worry about, but that one's one particularly I wanted to share with you. My co-residents have other stories that they'll share with you as well. Somebody that we just talked with here said, this changes who UC Davis is, and I want to be who UC Davis was when I came here. Thanks.
Hi, my name is Melissa Lichty, and I'm a second-year resident here at UC Davis. And I am here to advocate for my patients and for our residency in support of finding a solution for our patients that we're losing due to the negotiation with Health Net GMC. And I just wanted to share a patient story. This morning in my clinic, of my 5 patients that I was scheduled to see, 3 of them were Health Net GMC patients. And with each of them, I spent nearly half the visit talking about what this transition was going to mean for them. One patient in particular that was very upset is a 28-year-old with cognitive delay and seizure disorder, and they're non-English speaking, and they've been with UC Davis for over 15 years, and they don't know what they're going to do. Last month they had a home visit by one of the members of our department that they appreciated, and I don't know how they're going to be able to find this level of service at another facility. I expressed my disappointment to them and hope that we can find a way to support our patients through this. In addition to this, I'm concerned that our emergency department is going to see more patients that can't find care due to this gap in coverage. And I know that they have been reassigned to new providers, but it's going to take time for this to happen, and I'm just deeply concerned. Thank you very much for listening.
Hi, my name is Eleni Nerona, and I'm a second-year resident at UC Davis. I am deeply concerned and frustrated about what has been happening to our patients that we will be losing at the end of this month. I came in earlier this week to find 6 patients kind of give me a letter that they received for reassignments of primary care physicians. On these letters, I looked at 3 of them, and I called those centers, those community health centers that reported that they were not accepting new patients. I am kind of concerned about some of these patients who are very medically complex, who are going to be out on the street almost without medical care. And I feel as their physician that I need to advocate for them, because we are responsible for taking care of them. I have one patient in particular who has been with UC Davis for 23 years, and I see her daughter, whose baby I delivered a couple months ago, their child, and I feel like I'm losing a family that was integral, part of the UC Davis family. These are people who rely on our services, who in the community will not be able to access them in the way that on paper it says that they will. And so I'm asking you and urging you to gain your support to protect these patients. Thank you.